Mm.
Hello, everyone, and welcome to this webinar with the topic of health entrepreneurship as part of the International Paediatric Association's Young Paediatricians Leadership webinar series. My name is Priya Kevat, and I'll be one of the moderators today. I'm a specialist paediatrician working clinically in Queensland in Australia. I also work as a global health consultant with Melbourne Children's Global Health. And through that, I'm involved with international work in Cambodia and Lao People's Democratic Republic in the field of oxygen access, with partnership collaborations with the Ministries of Health, Clinton Health Access Initiative, and local organisations. I additionally hold an academic role with James Cook University in Queensland, Australia. I'd like to introduce you also to my co-moderator today, Dr. Ivan Bambia. Ivan is a paediatrician at the Department of Paediatrics University Hospital Center in Zagreb, Croatia. He is the Chief Respiratory Consultant for Children in the Cystic Fibrosis Center for Children and Adults in Zagreb, which is the only cystic fibrosis center in Croatia. His field of interests are also respiratory support for neuromuscular and hemato-oncological diseases in children. He is part of the team that performed the first paediatric lung transplant in Croatia. Until December 2023, he served twice as the chair of the Young European Academy of Paediatrics, representing the body of paediatric residents and young paediatricians in Europe. And now he works on revision of paediatric residency curriculum for EAP-EVP. He's also the founder of Young Positives Leadership Academy. So warm welcome to Yvonne as my co-moderator. A little about the topic today. Many young doctors find health entrepreneurship to be a potentially interesting pathway for a number of reasons, whether it's to develop a novel idea, to work for themselves, to bring a greater income or more flexibility in work hours, just to name a few. Some health systems encourage entrepreneurship, whilst others make it challenging for doctors to step outside of the usual pathways of work. Today, we wanted to explore the possibilities of health entrepreneurship, including what it may offer, as well as some of the downsides. And we have a number of esteemed guest speakers joining us. I'll hand over to Dr. Yvonne to introduce them.
Hello, everyone, and thank you for joining us. I really love it that you found our topic interesting and that you devoted your time to listening and finding something new about this interesting part of medicine that it's really not that much often commented on during our education. So, we have organized this in two ways. One is that we're going to first have a lecture from Ms. Raffaella Tripolo, and then we're going to have our three panelists that are entrepreneurs that are going to share their own experiences. So let's start. After each of the segments, we're going to have a Q&A, so you will be able to send your questions. As you can see in rules and regulations, you can type your questions during the lecture or the panelist exposition or afterwards in the chat, and then we're going to read it later, and one of the panelists or the lecturer is going to answer it. Okay, so we're starting. Our first lecturer is Ms. Raffaella Tripolo. She holds a BA and MA in Spanish and Anthropology, and as well as an MA in Public Health. With extensive experience in public health consultancy and event management, she has worked on key projects with organizations such as the World Health Organization in Europe and the World Bank. Currently, she manages pharmaceutical events at Avalier Health, overseeing complex on-site and virtual events for major clients, including AstraZeneca. Raffaella excels in stakeholder engagement, strategic planning, and delivering high-impact events, leveraging her background in both public health and the pharmaceutical industry. Thank you, Raffaella, for giving your time, and thank you really much, because you will see that Raffaella is a bit under the weather. So she's still decided she's a bit sick, so she still decided to have this lecture for all of us. Thank you, Raffaella, and this is your time.
Thank you for inviting me, and yes, please bear with me if I cough a little bit. I apologize in advance. So hello, everyone, and thank you for the introduction, and I think we should just start because I don't want to hold you up for too long. So let me just share my screen. I hope you can see it. So today's topic is that I will be talking about is entrepreneurship across healthcare systems from private to socialized models. We will be talking about entrepreneurship as a crucial element shaping modern healthcare systems. We'll be talking about different systems that are highly privatized or predominantly socialized, that all kind of rely on entrepreneurial activity in various forms. So as we all know, healthcare is a human right, but obviously the approach kind of in delivering how the services in healthcare are how they are delivered varies greatly across different countries, from radical privatization to full socializations, with many systems in between. Entrepreneurship plays a key role in driving innovation and improving service delivery across this spectrum, and improving service delivery across this spectrum. So this talk will explore how entrepreneurship manifests in healthcare systems across Europe, focusing on Switzerland, the Netherlands, and Denmark. These examples will illustrate how entrepreneurship flourishes in different contexts and impacts both the patients and healthcare professionals. So I have specifically chosen to focus on healthcare systems within Europe, as you will see, that have successfully integrated entrepreneurship into their frameworks. Although these systems range from highly privatized to predominantly socialized, they are characterized by strong regulation, firm governance, and a focus on progress and entrepreneurship. I've selected Europe because I'm more familiar with these systems. But I believe it doesn't really matter which countries we talk about, because the key takeaway is that regardless of the system, when there is strong regulation, firm governance, and a commitment to entrepreneurial innovation, healthcare can thrive, as you will see. So, I mean, if we kind of mirror this into any of the continents or any of the countries, if we talk about a very, privatized system that has kind of all of these other factors, it will still work, or it will not work if these other factors are not in place. Today's talk will explore how entrepreneurship can flourish across different healthcare models and what this means for both patients and healthcare providers. So let's focus on Switzerland first. In Switzerland, healthcare is predominantly privatized, with the government requiring every citizen to purchase health insurance from private companies. The government sets minimum coverage requirements, but beyond that, insurance competes to offer supplementary plans, creating a highly competitive market. Switzerland's system is designed to incentivize competition. So private insurance companies continuously innovate to offer more attractive packages, and providers must improve service to quality to stay competitive. So health insurance have invested heavily in digital health tools and wellness programs to differentiate themselves. For example, Swiss insurance offer discounts or premium reductions for policyholders who engage in preventive care, or who use fitness trackers, or who adopt healthier lifestyles. For example, if you can prove you go to the gym more often, if you wear a fitness tracker, if you can prove that you want to commit to a healthier lifestyle, your policy will be better, which kind of illustrate entrepreneurship in health plan design. As well, medtech is a booming industry in Switzerland, and Zurich and Basel are kind of major health hubs for healthcare startups and biotechnology companies. So there, I've wrote here Cutis and MindMaze that are innovating in fields such as tissue engineering and neurorehabilitation. But I also wrote Seymour because if you go specifically to this website, you will see that there are over 1,000 startups right now, because Switzerland has kind of created this very supportive regulatory environment, which encourages clinical trials, research and development, and cross-border partnerships. But not only cross-border partnerships, but also they kind of encourage collaboration with the industry, with the pharmaceutical industry, with the think tanks. So they have created an environment that is extremely beneficial for the startups, for the medtech, for anyone who kind of wants to grow there and who wants to develop in the medtech environment. So how does this work for the patients and the doctors in this position? So the patients in Switzerland enjoy a high degree of choice and access to cutting-edge healthcare services. However, the system can be extremely expensive. So there are significant out-of-pocket costs for services that are not fully covered by insurance, which is making healthcare more accessible for those with higher incomes. The entrepreneurial focus in Switzerland means that patients are often among the first ones to benefit from new medical technologies, advanced treatments, and high-quality private care, but only for those who can actually afford them. Speaking of doctors, private practice is definitely the norm, and then the doctors either own or partner in clinics, which creates opportunities, obviously, for entrepreneurship, but also increases pressure to run an efficient business. So it does mean that doctors are kind of equally health providers and businessmen. Many doctors collaborate with medtech startups, which is a great opportunity to kind of grow in scientifically and in startup-y way, or pharmaceutical companies, particularly in clinical trials, allowing them to contribute to and profit from medical innovations. This partnership between healthcare and tech entrepreneurs is a hallmark of the entire system. If we go on to the Netherlands, we see a mixed public-private model. So the Netherlands offers a regulated competition model where private health insurance provide mandatory basic health coverage. The government tightly regulates these insurance to ensure access and affordability, while insurance compete in areas like customer service and additional services. So it's more of like whether you choose to whether you pay in kind or whether you. So it's just like the shape of the policy is where they have flexibility. The Netherlands is known for its innovative insurance models, with companies offering personalized care plans and premium incentives for preventative care. Everyone's very focused on preventative care, from GPs to insurances to even the startups. Insurers use data-driven approaches to design products that cater to the needs of specific demographics, such as elderly care or chronic disease management. Health tech startups play a significant role in the Dutch healthcare landscape. So there are companies like Skin Vision or that have apps that allow users to screen for skin cancer. Platforms like Medicool, which provide virtual GP services. So these startups benefit from government support and access to the public health system, and that encourages experimentation in care delivery models. So as with everything, the Dutch government fosters a culture of innovation in healthcare. They are providing grants, tax incentives, and research partnerships for startups. So this has led to an ecosystem of telemedicine and e-health ventures, and many of which work closely with both the public and the private sectors to pilot new technologies and services. In this system, patients benefit both from universal access to a baseline of care, but then they also have flexibility to choose what kind of private insurance they want to cover their additional services. So they can have shorter wait times, they can have more specialized treatments, they can have enhanced care in private hospitals. So anything like that. And the presence of entrepreneurial insurance companies allow patients to customize their health plans, which does drive some innovation in the sector. For example, insurers are increasingly offering mental health services or tailored care for chronic conditions as part of their packages. When it comes to doctors, the Dutch doctors operate in both sectors, so public and private, which allows them to engage in entrepreneurial activities, such as opening private practices or collaborating with startups on new technologies. The Netherlands provides opportunities for doctors to innovate, particularly in digital health. So physicians can work with tech startups to pilot new apps, devices, treatment methods, so they basically can benefit equally as the patients, both from the public and the private healthcare system. So it's kind of mirroring as it is the mixed system. They're benefiting from both systems. And now we move on to Denmark, which is a fully socialized system. So Denmark has a tax-funded, predominantly socialized healthcare system, which means that the government provides universal healthcare. and the focus is on equity and, again, preventative care. However, there are still opportunities for entrepreneurship. But this is where we mentioned how it's governed, where the focus is, and what the kind of where the regulation sits. There are still many opportunities for entrepreneurship, and they particularly lie in public-private partnerships. So the public-private partnerships are basically the cornerstone of the entire healthcare innovation. So private companies work with the government to develop new technologies and improve the efficiency of the entire system. Denmark is actually a leader in telemedicine, and a lot of private companies pilot their digital health services within the system before actually scaling them commercially. Denmark's government supports a lot of health tech startups through innovation hub, such as the Copenhagen Bioscience Park, which is COBIS, which provides funding and mentorship to startups focused on health data management, AI diagnostics, and remote patient monitoring. So these companies often develop solutions that are later integrated back into the public health system, making innovative care more widely accessible. So it's basically the public health system is investing into innovation and bringing it back to the patients and using the system as kind of the testing ground. One of the examples is Lifeline Robotics, which was a Danish startup that developed an AI-driven robotic swab for COVID-19 testing, which is one of the examples of how there is a very quick urgent public health need addressed with something like in that system. So now we go on to how that works for the patients and doctors. So patients in Denmark obviously benefit from universal low-cost healthcare and access to many innovations developed through public-private collaborations. Denmark's emphasis on preventative care also means that patients are encouraged to adopt digital health tools, such as remote monitoring apps to manage chronic conditions and maintain wellness. Patients rarely or never face the financial burden seen in more privatized systems, and they also still benefit from the technological advancements brought by private sector collaborations, which are integrated into the public system. Danish doctors, on the other hand, are primarily employed by the public sector, where they focus on the actual care and preventative medicine. However, they also play a huge role, or the pivotal role, in testing and implementing new technologies and working with the private companies. So while entrepreneurship is less prevalent in clinical practice, many Danish doctors are still very involved in research collaborations and participate in clinical trials and working with new digital tools and medical devices. So these collaborations still allow them to work on all the new and exciting things, but kind of take away the pressure of having to be the businessman and running their private businesses. So if we want to do a comparative analysis of what entrepreneurship across the spectrum looks like, in Switzerland, entrepreneurship is at the heart of the healthcare system, and the competition is kind of driving innovation, but also contributing to higher costs for patients. The Netherlands, it kind of strikes a balance between public regulation and private innovation, which is allowing entrepreneurship to thrive within a framework that ensures universal access. Denmark demonstrates that even in a socialized system, entrepreneurship can flourish through public-private partnership and government-supported innovation, ensuring equitable access to healthcare innovation. If we compare the doctor-patient experience, patients in Switzerland and the Netherlands have more choice and access to premium services if they can afford them. Whereas Danish patients benefit from equal access to healthcare and innovation due to public funding. Doctors in Switzerland and the Netherlands often take on more entrepreneurial roles, managing private practices or collaborating with startups. In contrast, Danish doctors focus on public service, but still contribute to innovation through research and partnerships. Here, we do need to accentuate that. Obviously, when the doctors are in the systems where they have their own businesses, obviously they get more choice in what they want to work on. Whereas when the government mandates who they're working with, the doctors obviously have to do what the government mandates. So there is the question of choice, obviously, in research. So kind of the key takeaway is that entrepreneurship is not confined to any one type of healthcare system. So whether in a highly privatized model like Switzerland or a socialized model like Denmark, there are always opportunities for entrepreneurs to innovate and improve healthcare delivery. The patient experience and doctor's role shift across these models, but entrepreneurship remains a key driver of healthcare advancements, especially in areas like digital health, telemedicine, and medtech. So entrepreneurship is truly crucial to the future of healthcare. Each system, whether private, socialized, or a mix, offers its own set of unique challenges and opportunities for innovation. What we've explored today shows that regardless of the healthcare model, entrepreneurial initiatives have the power to transform care, making it more accessible, efficient, and patient-centered. Whether we're talking about a highly privatized system or one grounded in socialized care, entrepreneurial innovation can improve health for all, providing better outcomes for both patients and healthcare providers. So, as we continue to explore how healthcare systems evolve, it is essential to recognize the role of entrepreneurship in shaping the future of healthcare. But not just in terms of profit, but also in improving access, efficiency, and quality for all, but also ensuring that patients can benefit from equitable and innovative care, regardless of the systems that they're in. So finally, I leave you with this open-ended question: how can entrepreneurship continue to bridge the gap between innovation and actually equitable healthcare?
I think this is the eternal question that everybody's asking and nobody knows how to answer. Yes, we're all looking for the answer for that. Thank you, Rafaela, for this wonderful lecture. It is really great. I already had some remarks for myself and also some questions for you. But first of all, to see if we have any questions from the auditory or from any of colleague speakers. While we are looking for those questions, I'm gonna take the advantage of being a moderator and ask my questions first. So the first of my questions is, you said that the doctors in highly privatized systems are usually doctors and businessmen in the same moment. Are there like some kind of do they have to be two people, two roles in one person, so the doctor and the businessman, or are they usually teaming up with the businessman or having a consultancy who's doing the business part for them? Because it's the medicine itself is really high, and I mean it's really big thing to study, and then doing a business, that's also a whole other aspect of life. So it's hard to be expert in both fields. But so can you be two experts in one person, or do you really have to go for a partner in it?
So normally, in the GP practices, at least across the country that I've worked on, it's expected normally that obviously you have your business administrator, but all the decision making and everything is left to the doctor. So it is expected that somehow you as a doctor are also your own decision maker. which kind of is making you a businessman then.
Okay, thank you. Before switching to my next question, we have one question from Pramod Yog. I tried to translate it because it was in Spanish. So as much as Google Translator helped me, the question is, what are the challenges for entrepreneurship in Asian countries? If you have an experience with the Asian segment.
So I am not well equipped enough to talk about also just speaking about Asia. It's a huge continent. So I'm not well equipped, I don't think, or maybe would just go a bit more contained, maybe, in the question.
Yeah, it would maybe be helpful if Mr. Pramadyog could maybe just maybe expand his question. But we have another question in the meantime from Dr. Adrisa Yavo from Gambia. How do we balance entrepreneurship in a low resource setting?
Yeah, I think that's a good question. Um, it's very, I mean, also, how do we balance it from the perspective of the system or from the perspective of a doctor? Or can you please clarify?
Yes. Dr. Yavo, if you could just maybe also expand your question a bit.
The system. Um, yeah, so it is it is a good question because we do need to I think with entrepreneurship it is a question of a lot of stakeholders. Uh, so it's not only about the resources, it's also about the actual balance of governance between different stakeholders and how they're in play. So whether they're so it's about how the system is set up, if there is any space for actual doctors to be able to work with external stakeholders to develop anything. So whether you have any space as a doctor to work with any kind of technologies outside of your actual care work. And then so it's about regulation, but then it's also so it's about setting up regulation first in your system. So I wouldn't say the resource is the first step. It's actually about setting up regulation first. And you don't necessarily have to have a lot of resources in terms of money. It's about having resources in terms of people first. And I think obviously if you don't have that, then unfortunately you cannot kind of overstretch.
But would you say that maybe in a low resource setting that there is even a bigger position for entrepreneurship because if we're talking from the perspective of a system, the system has limited resources that it can give probably both in financial
Entrepreneurial.
so the government the system has to rely then on entrepreneurial let's say help or the possibilities because it cannot have enough strength within to just provide everything that they want, just as it was said in the examples in the completely socialized systems. So here it could be like a helping hand or a partner, a partnering opportunity to the system from the entrepreneurial part.
Of course, yeah. If we talk about like if you approach it as an individual,
Yeah.
But if we're talking from the systemic kind of approach, obviously there need to be kind of if we're talking like how you do it from a systemic approach, obviously the system cannot expect the individuals to set up entrepreneurial and entrepreneurships if they don't have enough resources to just cover their own expected work.
Great. Thank you. Well,
Um,
yes.
I can just see the next question that as a professional you are it is difficult to act entrepreneurially. Is there any solution? Yes, I think there is always a solution that as a professional to you can always go out and find different ways to find different ways in which you can collaborate with different companies. So if there are ways and if there are things that different fields that you find that yourself interested in, if there are different specific fields in medicine that you're interested in, the different patients that you like to work with. There is always, I think, different companies that are looking for collaborators in medicine. So that is always, I think, a different start to start working as an entrepreneur in that way. That also provides a lot of growth for you as a scientist, as a researcher. So I think that is a good start to start working as an entrepreneur. And then from there on, you also get to meet a lot of different people, and then maybe you get new ideas on how you can expand and grow just as a professional, as an individual.
Wonderful. Thank you. Thank you very much for all the answers you gave us. I hope that you will stay with us to listen to our next segment, and that is entrepreneur panelists talking. So we try to got free entrepreneurs in different areas of healthcare to share their expertise, just to say in a few words what are they doing? What were what was their motivation to start into that entrepreneurial adventure, and what are the biggest obstacles? And we're gonna have all three of the speakers going one after the other, and afterwards there will be a Q&A for everybody talking. So first we're gonna start with Mr. Noel Eche. Mr. Noel Eche was born in Cote d'Ivoire, and he's a computer engineer and data engineer from the diploma from ICA ISM in Paris. He's a pioneer in the e-health sector and a co-founder and the CEO of the startup Opisms. This he's going to talk about a bit more now. So after spending 4 years in a French company focused on banking solutions from telecompensation and another 4 years in food company, he dedicated himself to his primary goal, creating solutions to improve the daily lives of his fellow citizens. He has 20 years of experience, including 10 years in e-health. He's convinced that limited resources of African states characterized by insufficient technical infrastructure necessitate educating the population about hygiene practices through awareness to foster behavioral change. Given the high penetration of mobile telephony, why not use it to achieve public health objectives? After all, prevention saves lives. So, Mr. Eche, please, the floor is yours.
Okay, bonjour.
Mr. Eche is going to be talking in French, so there will be automatic AI translation that you'll be able to read at the bottom of the screens. Bonjour.
Ok, je suis Noël, je suis ravi de participer à votre conférence et aussi partager mon expérience de l'entrepreneuriat.
Sorry, just a second.
C'est bon, on peut continuer?
Yeah. Just a second, we're just trying to see if the translation is functioning.
Et,
Okay.
c'est bon?
Yes, you can start. Okay.
OK. Je disais que je suis ravi de participer à cette conférence et d'apporter mon expérience en tant qu'entrepreneur. Alors, on a commencé cette expérience depuis 2011 et disons que c'est pas une mauvaise expérience, on peut le dire, et personnelle. Mon neveu est tombé gravement malade pendant 5 jours, il était hospitalisé et il souffrait de la méningite. Mais Dieu merci, il fut guéri, mais avec des séquelles. Il est devenu sourd. Alors, on s'est rendu compte qu'il n'était pas à jour de ses vaccins et que le vaccin contre la méningite n'avait pas été fait. Donc, c'est ce qui m'a motivé, en fait, à pouvoir trouver une solution pour aider les parents à pouvoir faire les vaccins de leurs enfants. Figurez-vous qu'en Côte d'Ivoire, 81% des enfants de moins d'un an, in Ivory Coast, en Côte d'Ivoire, ne terminent pas leur série de vaccinations. Et pourtant, ces vaccins sont gratuits. Alors, qu'est-ce qui explique cela? Selon une étude, 30% des causes de non-vaccination sont dues à la méconnaissance du calendrier vaccinal, aux rumeurs et aussi à l'oubli. Forgotten. OK. Alors qu'on sait que 162% est le nombre du taux de pénétration du téléphone. 162% le taux de pénétration du téléphone en Côte d'Ivoire. Pourquoi ne pas utiliser cet outil-là pour pouvoir sensibiliser? C'est ainsi que nous avons mis en place OPSMS, qui est un service qui permet de rappeler de manière automatique et personnalisée les différents rendez-vous de vaccination et de pouvoir voir, connaître, calculer et surveiller la couverture vaccinale. Donc, notre difficulté, lorsque nous avons commencé, les mamans ne savent pas lire. Les adultes sont analphabètes. Donc, il fallait adapter la solution et nous avons mis en place un système d'appel vocal automatique dans la langue locale. Voilà. Donc, selon les ethnies de la maman, elle reçoit un appel automatiquement dans sa langue locale. Aussi, comme difficulté, nous avons le prix. Le vaccin étant gratuit, il fallait beaucoup communiquer sur le service pour que la maman qui souscrit fasse la différence entre le service de rappel qui est payant, c'est-à-dire notre service, et la vaccination qui est gratuite. Voilà. Donc, il fallait beaucoup communiquer dessus pour faire comprendre cela. Mais en même temps, on a tenté de trouver des solutions, n'est-ce pas, pour pouvoir rendre le service gratuit pour la population. Et jusqu'à présent, nous continuons de chercher. On a eu une fois l'apport de HKI, qui est une ONG, qui a subventionné le service pour la population au nord du pays. Et c'est très intéressant. Actuellement, nous faisons que, disons, 2 dollars par an. 2 dollars par an pour le prix que nous faisons. Et c'est très bas, mais vu la cible qu'on attaquait au départ, il fallait faire au mieux pour pouvoir atteindre notre objectif, celui d'amener tous les enfants à pouvoir respecter les différents annuels de vaccination. Mais après cela, on a dû ajouter d'autres formules pour adresser d'autres cibles. Les voyageurs, les entreprises, hein, et les adultes. Enfin, la caution gouvernementale est aussi importante. Et cette caution nous permet de pouvoir être présent dans les différents centres de santé. Alors, conclure, je vais dire que nous utilisons une technologie moins coûteuse, puisque la maman n'a pas besoin d'un téléphone, d'un iPhone ou bien d'un Android pour pouvoir recevoir les messages. Voilà. Et l'impact est énorme. L'impact est énorme et c'est ce qui est important. L'objectif principal, c'est d'amener la population à pouvoir se prévenir de certaines maladies qui sont évitables par la vaccination. Et le faire sans trop dépenser est aussi un défi aussi pour nos gouvernants. Je m'arrête ici. Si vous avez des questions, je serai ravi de les répondre. Merci.
Merci beaucoup. Oui. So we're gonna continue now. Please free to write your questions in the chat, and afterwards we're gonna give the questions for our speakers so they can answer you. We are continuing now. Our next speaker is Dr. Data Santorino. So Dr. Data Santorino is a visionary country manager of Camtech UTech. He is also a pediatrician and a lecturer at Mabarara University of Science and Technology. Dr. Data stands at the forefront of the MUST, pioneering groundbreaking initiatives like Augmented Infant Air Resuscitator. His unwavering commitment to pushing the boundaries of healthcare technology gave rise to the Camtech Uganda Robotics Program, aimed at empowering budding innovators with hands-on skills in engineering and technology. Dr. Data's passion for advancing healthcare technology and nurturing young talents is truly inspiring, setting the stage for a future where innovation thrives and lives are transformed. So, Dr. Santorino, please take the stage and share us your experience.
All right. Yeah, thank you so much. I think what led me into this space of entrepreneurship in health is two things. The fact that practicing health in providing healthcare in a developing country can be quite mind-boggling. There are quite a lot of challenges. And then the second thing is the realization that when there are challenges, we have to fix them because human problems are meant for humans to fix. There's nobody who is going to come and fix them for us. And so my passion started very early in trying to look at how we can identify problems early and respond to them in a time-sensitive fashion. And when I started that journey, I was quickly reminded that, charity does not scale, but sustainable business models do. And then the other thing that I was reminded of, which I discovered on my own, is that, as an individual, you cannot do things all by yourself. You need to be able to develop a system. And so when the opportunity came in 2012, we created the Camtech innovation ecosystem in Uganda that brought together engineers, health professionals, and other business people to really look at health problems in developing countries. And fast forward, we now talk about 10 companies, innovation-based companies that have come out of that. The number of patents that we have filed through that system and awarded are more than 10 now. And we have technologies that have been commercialized and are being commercialized. Some of them are in trials, others are in clinical use in India, Uganda, Tanzania, Kenya, Uzbekistan, and others. And I think irrespective of where we are, I think our greatest contribution to the world is trying to see whether we can be the solutions to the problems that others are facing. And by doing that, we need to do it collaboratively because as individuals, we don't have the bandwidth to do it alone, but whatever the problem, together we can be able to handle it. Thank you.
Thank you, Dr. Santorino. Thank you for this wonderful sharing. And now we're coming to our last speaker, Dr. Zvonimir Bosnic. Dr. Zvonimir Bosnic graduated from the Faculty of Medicine at the University of Osijek in 2016. Since 2020, he has been employed at a general practice clinic of his own, where he's began his specialist training. And he was appointed as assistant professor at the Faculty of Medicine in Osijek in the Department of Family Medicine. In 2020, he enrolled in his postgraduate studies in family medicine at the Uni of Rijeka. He has been a member of Croatian Medical Chamber, Medical Association, and European General Practice Research Network since 2022, and he defended his doctoral dissertation in 2023 on the topic interleukin-17A and IL-37 as markers of phenotypic subtypes in patients with type 2 diabetes. But what he's gonna be talking to us about is about CoreMed Polyclinic that he founded in 2022 in Slavonski Brod, which provides services in the fields of internal medicine, neurology, ophthalmology, ENT, dermatology, orthopedics, urology, and psychiatry. So Zvonimir, please take the floor and share us how was it for you to start your clinic?
Hello everyone. I suppose that you hear me all. Well, I would like to share my own experience in starting your own business as a young doctor. Well, firstly, I would like to say it's never too late to start your own business, but it depends of your own idea or you're managing. How would you like to spend your life during your work time? Well, as I started as a young doctor after finishing my medical faculty in Osijek, well, firstly, I was working as a GP in a small village next to my capital city. And I was a bit disappointed with this system of organizing of family medicine practice. And my own idea was to how to form your own practice and how to manage your own practice. And once a day, I have contacted a lady in a capital city in Croatian Institute of Health and asked, is it possible to start your own practice as a young doctor with a lot of experience? And then the lady has said to me, well, it's never too late to start your own business. There are some points how to start it. Well, there are some regulatives and some protocols how to do it. Firstly, you need to find an appropriate space that is organized by all the protocols according to Croatian Institute of Health. After finishing of that, you should need to find your employees, and after that, you should find a financial support. I have an amazing opportunity to contact the EU system, and I find a resource of financial support for buying every tool for my own practice. The whole process started firstly in 2020 when I started my own practice as a family medicine doctor. And also in that period, I was finishing my PhD. So it was a bit busy period for me because I was working too much. But when I started my own practice, according to all these statements, my own satisfaction was amazing. I cannot even describe the opportunity when you can organize your own day with all your patients, because I have a huge numbers of patients. Maybe we have some different system here in Croatia with GPs. Okay, well, because we have like own practice that can offer a help for like 2,000 of patients. So in my own practice, I have like 2,000 of patients. It sounds like a big number of patients, but with truly organized system, you can offer a lot of experience, and not only experience, a lot of diagnostics. But also, while I was firstly working as an internship in General Hospital Slavonski Brod, during a night shift, I was talking to my colleague who is a cardiologist and asked him, are you satisfied with working as a cardiologist in a public system? And my colleague said to me, well, I need to work a lot. It's not easy to be a cardiologist in a small general hospital with no like cardiac surgery, with no a lot of offers. So once a day, we have organized a meeting, and I asked him, are you open to start like a partnership that we can organize our private clinic? And he said to me, okay, it's a good question, and please give me some days to think about your own idea. After that meeting, I have searched for special resources of financial support in buying an equipment, all these tools for specialized medical equipment and the medical offer. And after all this process of like 6 months. And when I finally find the last one and the best one resource, we have started with this story of our own clinic. Also, I have organized a lot of meetings with all of my colleagues who are employed in also General Hospital of Slavonski Brod. And nowadays we have a big how can I say? Just a moment. A lot of people who are working for us. So nowadays we have like 25 colleagues who are working in our clinic, but it's not a full-time working, it's a part-time working. So it means that all our colleagues are employed in General Hospital of Slavonski Brod, and after their shift in a regular shift, they can work they can work in our clinics. It means they can work like twice a week or thrice a week. It all depends of the orders in our clinic. So we are fully private sector who can offer like medical support and medical diagnostic in 8 areas of medicine. And I would like to say I'm a bit satisfied with all this story, because there's so big problems in starting your own business for young doctors in Croatia. But if you would like to start it and you want to share your own experience once a day and be support for your young colleagues, I would repeat the first sentence: it's never too late to start your own business. You must be focused. You must be very patient at the beginning. You must know that there's not a lot of monies at the beginning of the story, but during the time, the whole system of your private practice can be really good organized, and you can do a lot of jobs, and you can do a lot of diagnostics. And now, after 2 years of my clinic with these colleagues and my own private clinic in family medicine practice, I can say definitely it's the best solution that I did in the last 4 years for me, and also for my own hometown. I suppose that my own story can be a good idea for all you colleagues who want to start your own business, because it's never too late to start your own business. Thank you for your time.
Thank you, Dr. Bosnich. This was wonderful. Especially like to see someone starting all from the beginning, from the start by itself. So I'll just love it how we have three completely different cases, three completely different examples of entrepreneurship, from the one being just doing medicine in the private sector to ones being high-tech entrepreneurials. So we have a mix that I think everybody can find something interesting, and everybody can relate partially to that. So we're gonna start with questions. Again, we have a question from our colleague from Pramadyog. And the first question is for Dr. Bosnich. What are the challenges that you are facing?
Well, it's a good question. I can say it's a big challenge for young doctors to start own business, because you must work a lot. Then you have no time for your private life, like for tripping abroad, for a lot of parties, because you need to organize of your financial support. Also, if I look forward and look all the challenges that that I had at the beginning of this story. Also, I had some problem with some administrative problems during the protocol of starting my own business. But for 6 or 7 months of doing it every day, now I can say there are a lot of challenges, But if you focus on all of it, you can solve it and you can find a best solution how to start it in a regular time.
Great, wonderful, thank you. We're going to continue with our questions. The next one is for Dr. Santorino. Did you have support from the I wouldn't say government, but for any kind of legal entities within the country when they saw what you were doing and that you're doing something really creative and that can help the health and the economy of the country? Was there some kind of support, or was it just legislative obstacles all the way?
As we say, it's a mixture of both. When it comes to government, the philosophy we decided to develop is that government is your best partner, but it's your last partner. And because it's your last partner, you need to develop the mechanism to survive without government before it actually comes to make you survive very well. And so there has been opportunities where we've worked with the government, and government has given us support, but most of our support has really come from philanthropic dollars, but also generating money from our own initiatives and our own companies. For example, for the first maybe 6 years of our existence, we were supported mainly by philanthropic dollars. And then during COVID, we lost all our philanthropic support. So all our grant support, we lost it all. So we had 0 ceilings. And I remember that time when we sat with my team and say, okay, looks like the end of the road. We've built something really nice here. What do we do? 2 options. I know all of us are very skilled. When we declare that the innovation ecosystem is over, people are just going to grab you and you go. The other option is we stick together and we make it happen. And so we agreed to stick together. And the first challenge was to make sure that everybody is paid in the next 30 days so that nobody feels they have lost income. And I think that was one of the most interesting times of my life when we went from hardly any money to sustaining and making sure that everybody is paid in the innovation ecosystem until we got our next grant. And that zeal has really driven the success of some of the companies that we formed. Because as an innovation app, we had companies that were owned by us, the people running the innovation lab, but also companies that were formed by other innovators, and we did not really have ownership. And so we saw the value of having both, and yes.
Dr.
Great.
Santorino, how did you navigate moving from clinical work into the world of tech? Was that a difficult move, or were you trying to balance both at the same time?
I've been trying to balance both because I believe in this thing that as a clinician, I understood the challenges that I wanted to solve in medicine. But also, you need to understand the problem a little bit deeply. And I think my advantage was that when I started juggling both clinical work and building the innovation ecosystem, my head of department was really supportive. He saw how overworked I looked. And one time, may his soul rest in peace, he called me to his office and he said, Dr. Data, you know what? there are many things that you do that we can do, but there are so many things that you do that we cannot do. And so please, I would like you to advise us on how you want to balance your time between doing innovations in health and supporting the department. And that was the best thing that ever happened to me. And I think if I did not have a head of department who thought like him, I probably would have burnt out.
Sounds like a supportive leader.
Yeah.
We are getting more and more questions here, but before we read the questions, just one question for Noel Etchem. I find it fascinating that you decided to charge the using of the application. What were your reasons for that decision and against that decision? Pros and cons when you were deciding that you were gonna charge for the application, because the majority of applications today are usually free. I hope I wasn't just too fast for the translator.
Ok, en fait, au départ, on a tout de suite mis un prix. On a tout de suite facturé le service disons, à $1, hein, à $1. Et on a vu qu'on ne pouvait pas supporter les frais. Et c'est après cela que nous avons augmenté, on a doublé à $2. Voilà. Donc, le service, les intrants, c'est-à-dire que c'est surtout les SMS. Les SMS, ils sont coûteux, c'est pas gratuit. Les maisons de téléphonie ne nous le donnent pas gratuitement. Même quand c'est un service de santé, ils ne voient pas l'intérêt, ils voient plutôt le business derrière. Et donc, on était obligé de pouvoir faire facturer cela pour pouvoir supporter les coûts. Le coût au niveau du serveur également, et aussi le coût au niveau des opérateurs de saisie. Comme on vous l'a dit, comme je l'ai dit tout à l'heure, la cible ne sait pas écrire ni lire. Donc, les informations que nous prenons d'eux, nous sommes obligés de les saisir à l'ordinateur. Ce n'est pas la cible même qui enregistre les données. Donc, on prend des opérateurs de saisie qui font la saisie. Ils font la saisie des données.
Okay. Great.
Donc, on ne peut pas le rendre gratuit. Toutefois, on cherche des ONG, des organismes qui peuvent rendre ce service gratuit en préfinançant, par exemple, pour ces moments-là, pour qu'elles puissent avoir ce service gratuitement.
Great. Thank you. Merci. We will continue with questions from the audience. So the next one is from for Zvonimir, from Candice Shah. Hello and thank you for lovely talks. I would like to know from Zvonimir, what do you do to support your mental health and overall well-being, because it can be stressful?
Well, I definitely agree with this question, but as everyone started their own business, or everyone started their own practice in any kind of workshop, well, you should be firstly well organized and focused on all the obligations that you have in that period. So it's normal for me to work a lot at the beginning of something. I can compare it like with doing some studying or doing a research. So it means at the beginning, you should work a lot. And during the time, you will be better organized, or you will be focused on some lacks of or problems that you can share with someone. Or actually, I can say that for my well-being, I used to go to the gym. I find it as a good solution for dealing with stress, but also what can I say? Also, another form was because it can be said. I also agree that my own story was a bit stressful at the beginning, but after a month of doing my own practice, this stress was lowering. So nowadays I have like normal condition with more time for my own private life. And if you organize all the things in your own day, you can be a very happy person.
Did you have any special training in business, or you just had the mindset already?
No, it's not only the mindset. I try to follow all the news and all the new protocols in this regulative system, but also I try to follow a lot of congress and a lot of conferences that are focusing in the management of health, management in primary health care, management for young doctors, EU resources for young doctors. So you should actually you should follow a lot of information and try to find the best one that you can use in your own practice or in your own life.
Great. Thank you. And now we turn to Dr. Santorino again with a question from Emmanuel Opong from Ghana. He said, thanks for IPA for this brilliant event. How did you translate your ideas for developing medical devices to address everyday clinical problems to patent approval?
So one thing, the innovation world, the currency of innovation is intellectual property. Because when people think about your innovation, whether they are going to invest in it or they are not going to invest in it, sometimes depends on intellectual property. And so when our team described our first innovation to really address the issue of supporting health workers to breathe for babies effectively, we described that problem in a hackathon, and we won the hackathon. And immediately after that event, we got a lot of emails telling us, please patent this idea, patent this and patent that. And that was the beginning of our journey into IP. And fast forward, when we realized that IP is so important in the innovation world, we also accepted some of our strengths and weaknesses. And one of our weaknesses in Uganda was, in our ecosystem, was how to put together a patent application. So we deliberately went to the Uganda Registration Services Bureau that had all the patent examiners. And we talked to them and said, look, we know one of your roles is to assess whether our applications for patents are strong enough to actually be awarded a patent. But the truth is we are not going to apply for patents unless you come down to us and actually work with us. So we developed this relationship with them where every year we call the patent examiners from the Uganda Registration Services Bureau, and we open up our portfolio of innovations and we discuss the innovations to see which one has a potential for IP and which one doesn't. And those that have potential for IP, what kind of IP and the reasons why. And that really helped build our capacity to be able to play in the field of intellectual property quite a lot.
Wonderful. Thank you. And we have one last question, again from Mr. Emmanuel Opong from Ghana, again for Dr. Santorino. How did you bring on board business persons to partner with you to advance your innovations? Do you just approach a notable person and pitch your idea, or there are proven processes that actually work?
I think the first principle is when you don't ask, you will never know. And the second one is when you are in need. I don't believe in this philosophy that when you share your problems, people will laugh at you. The truth is some people will laugh at you, but some will actually help you. And so the idea there is wherever there is a forum to share your idea, go for it. Pitch events, pitch. When they require you to put together a business plan, even if you don't know how to put it together, put together the team that can put together the business plan, but provide the business plan to them. And so it's philosophy of just going to knock.
Great. Thank you. And with this question, we are going to wrap up our leadership webinar today. I want to thank all of our speakers for giving their time and their expertise. Merci, merci. And I would just like to invite all of you here to join our next webinar. That's probably gonna be at the beginning of November. The topics are the following. We are going to be talking about media communication strategies and change and innovation. So we are slightly just continuing on to this topic. You will be informed via IPA flyers on time, and I hope to see all of you there again. If you have any kind of comments, suggestions, please share it with us so we can know how can we improve our webinars to make them more interesting to you. And because our point here is to be helpful, to be of service to young pediatricians all over the world, and we can't do it unless you give us some kind of feedback. Thank you, admin office, for support. Thank you, Priya, for co-hosting, co-moderating, for everything, and looking forward to see you all again. Bye-bye.
Bye-bye. Bye. Thank you very much. Au revoir et merci beaucoup.